Hi, my name is Guy Ringler, and I'm a reproductive endocrinologist with California Fertility Partners in Los Angeles. The United States offers the finest medical care available. In IVF, reproductive medicine, we have always been at the forefront of the science. And so by coming to the United States for in vitro fertilization, for egg donation, surrogacy, you have access to some of the finest reproductive medicine clinics in the world. The egg donation surrogacy programs are well organized, the screening is well established. So by entering into those programs, you benefit from years of experience, years of establishing protocols, safety requirements. You have access to a variety of candidates and possibilities. You have much greater access than you have in other countries where it may be possible, but there's limited availability. You can decide whether you want to meet the donor or remain anonymous. You have many more candidates to select from. We have specifically outlined screening protocols, so you know that the eggs and embryos being generated are safe and are going to really give you the highest chance of pregnancy. International clients frequently come to California Fertility Partners for services that are not provided in their countries, such as egg donation and gestational surrogacy. In many countries, egg donation is not allowed, or there are certain restrictions on egg donation which really limits the access to egg donors, candidates. Egg donation is very well established in the United States, and we have very well organized, well established egg donation programs here in the Los Angeles area. So patients have access and choice. And we have here in California Fertility Partners, we have a very well organized egg donation program. So we have specialized egg donation nurses that deal specifically with helping to organize and monitor patients going through the egg donation process. And surrogacy, we see many patients from around the world come to California Fertility Partners for gestational surrogacy. I think everyone has to do their research. They have to find out how long the clinic has been in existence, what type of patients they see, do they have expertise in certain areas, and what type of support care do they have? What type of nursing staff do they have, and where do they do their procedures? Is it on-site? Do they have to go off-site to another facility in order to undergo the procedures? And who's doing the monitoring? The monitoring of the ovarian response is very important in this process. So are they being monitored by their physician? Are they being monitored by a technician, a nurse? You want to be monitored and decisions to be made by your treating physician, ideally. You want to know who's making the decisions, who's taking care of you. And so those are all very important factors. And I think you as the patient, it's a very important decision that you're making. It's a very important process for you. You need to feel comfortable. You need to feel that not only are you receiving the best care possible, but your personal needs are being met. You're being well taken care of. Our patients who are seeking egg donation, we have a list of egg donation agencies that we have pre-screened. So we've selected egg donor agency that we know follow the recommended professional guidelines, and so we can confidently provide them with a list of agencies that we know will take good care of them and do a good job at doing the initial recruitment and screening of egg donors. And I always advise my patients to select the donor that they feel most comfortable with. Everyone has certain ideas in mind of what they hope to find in an egg donor, and I think we have enough variety here of agencies and candidates that everyone, if they do their homework, can find the best individual for them. For individuals who need a gestational carrier, we refer them to surrogacy agencies who conduct initial recruitment and screening of surrogacy candidates, and these are agencies that we have worked with over the years that we trust will take good care of our patients and will help them in the matching with the gestational carrier and follow them through the process. As your physician, I'm always available, either by phone or by email. But as an international patient, you're assigned to a specific nurse who is always available as well for phone calls, questions, emails. We're all readily available. We're open 7 days a week because we haven't figured out a way to turn off the ovaries on the weekends, so we need to be here.